way back.
Ooh. Yeah.
Hello everyone, this is Dr. Brenda Mondragon. Before we get started, possibly think about subscribing. Moving on to the video.
I've noticed about 3 years ago that this shoulder is lower than my right. And then also when I stand, you can see that, so this arm hits my shoulder, but this one doesn't. It's like there's a gap.
Mm-hmm.
On the left side of my lower back is tighter.
Just come this way so you can see
Okay.
it. I can see it.
Yeah.
This is something that I have to figure out why
Yeah.
you have this.
And I
believe it's your mid-back though.
The what?
Your mid-back.
The mid-back, yeah.
I believe it's coming from the mid-back.
Yeah. And I do yoga and I do aerial silks. And I feel like it's like I have injuries on my left shoulder. And then also my neck, like lately this is like the main reason. My neck has been just like every morning like killing me. Like for the past, I want to say like 2 months. It's just like insane how like
Are you doing
tight it
anything
is.
new?
No.
Nothing.
If anything, I'm doing less.
You're hanging upside down?
Yeah, so it's, I don't know if you've seen it. It's basically like 2 strips of fabric, and then like you can climb them, you do tricks, you like wrap yourself and then do drops and stuff. And I also do doubles too. So basically he's like up in this, they call it cross back straddle, and then like he's upside down holding me, and then like we're doing like, you know, tricks and stuff.
Okay, so you get injured on this side more often?
It seems to be my left shoulder, which is weird because I'm right-handed.
Well, when you have a shoulder that's dropped like
Yeah,
that,
and that's the dropped one.
Sometimes it's slightly sitting out of socket.
Mm-hmm.
Slightly. It's not like it's out of socket. It's just more vulnerable, in a more vulnerable position because it's out. So a shoulder, I can show it. If it's dropped, you can kind of see it will come out of socket slightly.
Okay.
The only way to get it really back into socket is to put your chest out. Yes, that will put your shoulders back into place. Go walk to the end of the carpet for me and turn around.
I have to like try not to like walk weird just because
I know.
someone's telling me to walk.
I know. It takes a couple of times for people to like get a foot. Okay, yeah, you're definitely pronating on the foot when you walk. So that's the first thing I noticed.
Also, when I walk, like or do anything really, my knees crack like all the time. Like they're doing it now.
I hear it. So come on and stand here. I'm going to check her posture really quickly. I believe you're just going to have your hands together, feet together, and you're just going to touch your toes.
Okay.
And tuck your head for me. It's not bad, but it's there, right here. Spine is curving to the right like this, and that's going to pull your shoulder down.
Gotcha. Yeah.
Okay? That's all this is. Your spine has a curve. That's all it is. I have a curve the other way.
Okay.
So I'm constantly
So we're like
fighting it. Yes, I'm like this, and this side collapses, and this side I bust it all the time. Actually, I've busted the right side too, but trying to fix myself, trying to go this side. You know, you do yoga, right?
I do, yeah. So we do.
So go
things,
this way.
So go that way.
Yes, open that side up. Your hip goes to the right.
Yeah, I kind of see like it kind of like goes like.
And it's
like
you
that,
have an anterior side, I believe, on this side. But you're going to be battling this, and you're going to have to try to open that side up.
Okay.
Okay, then if you do yoga,
That'll be a good opportunity
both
to do it.
Yeah, right. You're going to want to
and
go
back bends too. Would that be a good idea?
as long as you're using your thoracic spine.
Okay.
A lot of yogis, they like to rely on the flexibility of the lower spine, and I tell them don't do that. You're gonna bust your facets if you do that.
Okay.
It doesn't feel. It's not good. You're gonna jam them. So use, the upper part first.
Yeah.
Get that up first and then go back. Okay. And if you try to do that, I can only go to here. But wait, if I let myself. So try to be conscious of that. Don't be the most flexible person in the room. Eventually, you will be the most flexible person in the room because you're using your thoracic spine.
Doing it the right way.
Yeah, this has to bend.
Okay.
We're real flexible here. Your core, right, holds your lower back together.
Where you have your ribs.
Yeah. Relax, I got you. Perfect. Relax. Good. So this one, there's so little. I'm like, okay, we're gonna go. Oh!
Yeah.
think you're okay. I don't need to whack you. Okay, well, here we go. You just let me know if anything is sharp or tender, okay?
Okay. It's kind of just like dull. I mean, I feel the tenderness, but
Nothing is sharp.
yeah.
Okay. Go through these little.
I feel things moving. Is that weird?
Yeah.
Okay, so
No, totally normal.
because before I couldn't even like lay, you know, happy baby, like the pose in yoga. It's literally just this, like, and then you grab your feet. I couldn't even lay on my back straight because this side of my back was so tight that it was like leaning me to the side.
Okay. So I'm going to go through each articulation here.
Okay.
Yep. Wiggle it. Get it. This is your good side.
It is.
So I'm doing this one first. This is where the joints come together.
Okay.
And you can increase their range of motion by taking it into extension.
Okay.
Because what do we do all day? We're in
Hunched
forward
over.
flexion.
Yeah.
So I take it backwards. Take the neck backwards. Get more extension. Will increase your range of motion. So while you're hanging upside down is great,
Mm-hmm.
but if you don't go backwards, you lose half of the range of motion there.
Gotcha.
Same thing again, going back.
Oh yeah, that's way more sensitive on this side.
I feel it. Just let me work on it. If it's too much, just let me know.
Okay.
Just keep breathing. This is what I tell people, like, breathe. Breathe through it if you can. That's it. That's it. Don't hold your breath. I can feel it when you hold it. Yeah. It's okay. There you go. Get down to the shoulder. Here we go.
Bringing out the big gun.
Yeah, when I use the knuckles, we know it gets serious. That's it. I'm gonna hold it. That's it. And I come through the vertebrae. I'm like right here on her joint. I wiggle and go on. That's it. I feel that little guy there.
Mm-hmm.
That's it. Trying to take the tension off of it. Well, let's adjust it.
All right, so just like stay relaxed. I'm kind of nervous about this.
Okay. Were you feeling dizziness or vertigo at all during that whole thing?
No.
Okay. You're going to be fine.
Okay.
Because that was actually more intense than what this adjustment is.
Oh, really? Okay.
Yeah. You're going to be surprised. I don't think you're going to have a problem with it. Chin back for me.
Oh, God.
There you go.
I thought it was just going to be that one pop, and then there was like 10 after. I was like, whoa.
Well, now we got to do the other side. You ready? What, did it hurt?
No.
No! We're just ungluing stuff. It's not a big deal. It just sounds intense.
Yeah.
There you go. Chin back. Same thing. Done. Okay, done. You did it. Yeah, that's it. See, now look.
It feels loose, yeah.
Whee!
I'm going to be like an owl. My head's going to go backwards.
Very good. I never know what people got in them, until I actually do it. People are like, can't you tell? I'm like, not really. until I actually go for it. Then I'm like, ah, now I know. It's kind of a weird profession. But yeah, now look at that.
Yeah,
way more
wow.
range of motion, okay?
There's no tightness.
That's all you need. You just needed somebody to unlock that for you. I'm not getting too much. This is the foot that is pronated, so it's not going to pop as much. Mm-hmm. But if you're wondering why these aren't popping, it's because you put more weight on these toes, so the joints don't have anything in them.
Okay.
My fingers rarely pop because I'm always doing this stuff, yeah. Now this foot doesn't. Yeah, we got a little one there. Okay, there was more pops on this one. This one isn't as
Cool.
ankles. I should have said that before I did it. See how this one, your knee wants to go before the ankle. Tension out of the knee. Get it that way.
I felt it, yeah.
I'm a joint mobilizer, okay? That's my job. People are like, why does she do the whole, because the whole body needs it.
Yeah.
You're gonna reach overhead and grab the table for me. Yep. Hold on. Hold on.
Oh.
Hip.
Yeah. Oh, yeah.
All right. Now we don't get to see you for the next 30, 40 minutes. You're gonna flip over on your stomach, okay?
Okay.
Yeah, it's right here. So she has a lateral curvature right here. So I can count them. Here's T1, 2, 3, 4, 5, 6, 7, and then right at 8, it shifts over T8, 9, 10, 11, 12, all the way down into the low back. So this is why your hip is over to the right. Okay. So you have a curve here, pushing it to the right. Yeah, you can just tell that this is all puffed up right here. And then here's this, and here's the switch. Okay, and then right here. So a lot of times you're gonna have pain here because that's where it jackknifes. Can you see how this side is puffed up here compared to this side? Like this, my thumb just sinks right in. And over here, her QL is overly contracted.
And that's what I mean. Before I got the acupuncture, this side was so puffed up that, like, laying on my back, like, I couldn't lay flat. Like, I would be kind of tilted.
No kidney issues, no urinary tract infections, nothing like that?
No.
No pain here when I do this?
Nope.
Okay. Yeah, see how her QL, this is her QL. It's like a upside down V. And here, it's just so much more prominent. And her paraspinal muscles. Right there's the worst of it. Right there, I found that one. Yeah, here's the bait and switch right here. This is where it went.
Yeah.
I'm gonna switch it. Okay. So, you know, see how I can just kind of sink right in here and then not so much here. Okay, and that's curvature. Take a deep breath in. All the way out. Excellent. And again. Excellent. Okay, and then again. Perfect. All right, breath in. Excellent, good. I'll let it all out. Okay, that's as low as I'm going. Leave. There's a slight variation there, but no, they're all closed. Very good.
Okay.
Just gonna traction down. Yeah, there's that right, that's the beginning. Oof. Doing okay?
Mm-hmm.
This might be a little rough, that's why I'm asking.
No, it feels really good actually.
This side we gotta open up.
Mm-hmm.
Okay, elbow, if you can handle it.
Okay.
Breathe. It's right there. Oof.
Mm-hmm.
Breathe. So for this one, come up off the table a little bit and then lean over to this side. Don't worry about the paper at this point. Yeah, I just want you to kind of rest like that with the arm up.
Okay.
I'm gonna try to open this up over here. Breathe. Breathe, 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 breathe. Yeah, I need to see it. There you go.
You have to make sure I'm still alive.
Well, when you take a deep breath, certain muscles flex.
Oh, gotcha.
And so I can see them better. Like you're doing, what did you say? You're studying respirations?
Yeah.
What do you look for, right? You look in between the ribs.
Mm-hmm.
Okay, you're trying to see the ribs. Okay, other side. Now go back the other way now.
Okay.
Actually,
See, I feel more at the top of the glute than the lower back at all, both sides.
I'm gonna check the upper glute
Yeah.
on this side. Okay. Well, yeah, because then I gotta go up into here.
Okay.
So I'm taking you more and more extreme every time we.
Yeah, see, I feel it here, whereas like that lower back, I wasn't feeling it. Like I felt it.
You felt
obviously,
nothing?
but yeah.
I just do the upper glutes. With the roller, I can go down the glute, the entire glute. No, actually nothing. Very good. No. Awesome. Down the leg. Calf. She got a little knot here on the left. Right there. Got it. Got it. Don't have to do it again. If I can just roll right through it, I'm done. See, there's a huge knot there. You can see it right
like,
there.
It's almost like a nerve reaction too. Like
Well, the sciatic nerve is right here.
Yeah.
But you're very sensitive.
Mm-hmm.
I'm the same way. I'm a nervy person, we call it. Your nerves are just real sensitive to any kind of touch. Some people have thicker casings on their nerves. Schwann cells. Oh, there's one here.
Ooh.
There, got it. All right, done. Little one here.
Mm-hmm.
There you go. It's not too bad.
Okay.
You've just got one one here, but the rib that's breaking the force of this curve is congested. Okay, so she's got that all the way down into there. That's it. This side's just a general redness.
I feel it's like weird, like sensation there since you moved
right here.
Down. Yeah.
Yeah, you have. I'll show you in a second. I'm just gonna wipe the oil from the bottom half of you and then move to the top. So it's gonna be cold, but you feel the heat coming in. That's that's your body doing its thing. Feels good.
Yeah, the scraping's not bad. I thought this was gonna be painful.
No.
Yeah, it's not at all.
This is where all the force is being applied here.
That feels really good.
Yeah, there you go. Get it.
Oh, I feel. Yeah, that's.
Ooh.
Yeah.
Here, I don't know. Oh, yeah, there it is. Oh, surprisingly, your left-hand side is way worse.
Mm-hmm.
Don't use those words. Okay, fine. It's more red. Massage therapist, get on my case. Like, don't talk to the patient that way.
Oh my gosh.
I'm like, oh, it is what it is. Oh my, I found a whole plethora of them. It's not over here. I thought for sure it would have been over here because this is the raised side.
Yeah.
So you're basically what's happening is you're turning red in the areas that are crunched, that are, have collapsed. Not lack of a better word, that have a lot of force being on the underside of the curve. Like it's not really coming out where the curve is over here. You know, the curve is like this on you, right?
Yeah.
I would think it would come out over here. Usually it does, but yours is on the crunched side, the side with more pressure. It's not coming out like this side.
It doesn't, yeah, this side I could definitely feel more of a sensation than the other side.
Same thing with your neck. Okay, same thing. The right side is the side with the curve, but this is the whole side here came out red. All right, let's take a picture of it.
Oh my gosh, wow. That's crazy. Look at the pores.
I didn't see that on that.
Oh my gosh.
No, okay, look at that. Which one are you looking at? Okay,
This
that's
is
the
the
rib.
second one.
Now look,
oh, that's the,
keep going.
Wow.
We took a couple of them. There's your neck.
Oh my gosh.
So this side is there. Yeah.
Look at that.
No, the dark.
That looks like a burn.
No, feel your skin. It feels fine.
Yeah.
It's just hot.
Look at that at the neck.
But yeah,
That's crazy.
But that just comes out, and this side
Wow.
didn't. You know, this side's just red from me rubbing it, but no petechiae. This side
you
can
can see, yeah.
Yeah, it came out.
And yeah.
I know,
Wow.
in random places.
Wow.
I'm like, okay.
That's crazy.
So now you have a souvenir because it doesn't usually do it again.
And people were saying it's more about the nervous system than your actual muscles.
Right.
Oh, okay. Do you,
well,
like, agree with that?
that's what chiropractic is.
Yeah.
Chiropractic, we believe that if we fix the nervous system, everything else, it wouldn't matter so much in doing the soft tissue work. However, the way that I look at things, I can't even get to the nervous system unless I get rid of the knots first.
Yeah.
I can't get there. And that's what I'm doing. I'm just checking right here under your clavicle. It feels fine though.
Okay.
And then relax. All this is just proprioception. Telling your brain, hey, I have a thumb. Hey, I have a wrist. Hey, this feels great. Your wrists feel awesome. Haven't felt a wrist that good in a while.
Wow.
Yeah, no, these all feel very healthy. They glide, they move, no crepitus.
It's that grip, right?
Yeah, it feels good. Now head goes off the table.
Oh.
Yep, you're very flexible. So we might keeping that leg there. Awesome. Push up. You gotta be fast and precise with that one. You know, it's this thick.
Wow.
It's just this enormous joint. So you have to be.
Yeah.
It's the SI joint.
Oh, okay.
So it is like the most difficult joint for me to adjust. This one we gotta go way back.
Ooh. Yeah.
On your back. Bend both of your knees. 2, 1. Relax. And squeeze. Good. No scar tissue. You're fine. All right. Now we're done, I think. We can do the ears, but I know you're so sensitive. I don't know.
I kind of want them done.
You want them done?
Because I kind of have sinus issues, and that's supposed to help with that, right?
Oh yeah, I didn't even think to check your sinuses. And then lean away from me. Nothing.
Oh, there it goes.
Tiny bit.
Yeah.
Lean away. Good. Very good. Nice. That's all it is. So what'd you think of your first adjustment?
I liked it. I definitely think.
okay?
Yeah. It wasn't as scary as I thought it was gonna be.
You were so nervous. I was like,
Yeah.
oh, I feel bad, you know. But you know what? You've gone through it. You know what it is now.
Mhm.
You know, it's nothing to really
Yeah.
be afraid of. Go ahead and sit here and face that way. We're gonna stretch you out here. Okay. No, you're gonna come.
Oh, it has to be like.
Yes.
Okay.
Now that's gonna feel uncomfortable. Bend your knees.
Yeah.
Now, I don't know if you can go all the way. Roll up a little higher. No, other way. Right under the armpit. Yeah. You feel that tearing almost?
Yeah,
It's like
it feels-
it's really stretching on
It
this
feels
side.
productive though.